It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question that our readers ask quite frequently. And the question last week was, how long can a critically ill patient be on a ventilator with a tracheostomy in intensive care? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question that many of our readers here at IntensiveCareHotline.com want to know about if their loved one is critically ill in intensive care. And in this week, I want to answer, how long does it take to wake up after an induced coma? Now, if your critically ill loved one has been admitted to intensive care, and if your critically ill loved one is or has been in an induced coma, you, of course, have been wondering, how long does it take to wake up after an induced coma? It's a great question to ask, and after all, it's a question you would want to know the answer to, especially since you are feeling rather helpless in such a stressful, difficult, challenging and overwhelming situation, such as having a loved one critically ill in intensive care. So now let's get to the meat of the question and let's get to look at the answers. Now, again, if your critically ill loved one is or has been in an induced coma and has been ventilated with a breathing tube, it can be rather normal that your critically ill loved one isn't waking up straight away. There sometimes can be a delay in waking up because of, number one, the amount of drugs being given for sedation and opiates. Opiates are pain medications such as morphine or fentanyl. Once your critically ill loved one is in the induced coma, in order to tolerate mechanical ventilation and the breathing tube, an induced coma is necessary for your loved one in order to tolerate mechanical ventilation and the breathing tube, also known as endotracheal tube. Number two, the reason why your critically ill loved one has been in an induced coma. For example, an induced coma for head or brain injuries is generally speaking more difficult to come out of compared to an induced coma for quote-unquote straightforward surgery or for less acute and or quote-unquote softer admissions into intensive care. Number three, the length of the induced coma. Generally speaking, the longer the induced coma, the more likely it is to have a delay in waking up. Number four, waking up is generally speaking a process and not an event that you can compare to switching on a light with a dimmer rather than switching on a light with a switch. Number five, your critically ill loved one's age might be a factor too. Generally speaking, with increasing age, the higher the risk of going through a quote-unquote delay when waking up and coming out of the induced coma fully functioning. Number six, another risk factor is severe or heavy drug and alcohol abuse. If your critically ill loved one is using drugs and or alcohol on a regular basis, it's more likely that when induced into a coma, that a lot more sedatives and opiate drugs are being used compared to a patient who doesn't use drugs and or drinks alcohol. When waking up and coming out of the induced coma, your critically ill loved one has a higher chance of being confused and agitated. Sometimes they may even be aggressive. So now let's break this issue even further down and let's look at time frames. Number one, your critically ill loved one is in intensive care and is a quote-unquote straightforward or quote-unquote soft admission to intensive care. So if your critically ill loved one is a straightforward admission to intensive care after elective or planned surgery, or is a soft admission to intensive care for a medical emergency on a ward, etc., your critically ill loved one should come off the ventilator or respirator and out of the induced coma relatively quickly within 12 to 72 hours. In those circumstances, your critically ill loved one should be on short-acting sedatives, such as propofol, also known as Diprivan. Propofol or Diprivan is a sedative that is widely used in intensive care to put patients asleep, and it is used as a short-acting sedative, meaning that when switched off, your critically ill loved one should wake up relatively quickly, sometimes within minutes or hours. That can still mean that your critically ill loved one can be confused after the induced coma. Next, number 2. Your critically ill loved one has been in an induced coma and ventilated for 3 to 7 days. Now, if your critically ill loved one is a more complicated admission to intensive care and your loved one may be more unstable, such as after a car accident or after major surgery where complications may occur, or if your loved one sustained a severe head or brain injury or had a heart attack or a cardiac arrest, then the breathing tube or the endotracheal tube, the ventilator, and the induced coma might be required for more than 72 hours. And if your loved one is stable and progressing, breathing up on the ventilator with the support from the ventilator being reduced, then again, your critically ill loved one should be able to come off the ventilator after the sedation and the opiates, again, opiates are pain medication, have been removed and minimized. By removing, weaning, and minimizing the drugs that keep your critically ill loved one in the induced coma, your loved one should slowly but surely waking up. This at times can take time because, just as I have explained in number 1, where your critically ill loved one may be sedated with short-acting sedatives such as propofol, the longer sedation for the induced coma is required, the more likely it is that a longer-acting sedative such as midazolam, also known as Versed, is used. Midazolam or Versed is a benzodiazepine, and the longer a benzodiazepine is used, the higher the risk and the likelihood that your critically ill loved one is getting addicted to it. Therefore, getting your critically ill loved one out of the induced coma might have some challenges, such as withdrawal symptoms, and therefore a gradual weaning of the midazolam or Versed might delay waking up. With midazolam or Versed being a longer-acting sedative, chances are that the longer the medication is being given, the longer it takes to wake up after an induced coma. The same applies to the opiates, which are pain medications that are given during an induced coma, such as morphine, fentanyl, or sometimes ketamine. Those drugs can be addictive as well, and just like with midazolam or Versed, the longer your critically ill loved one has been receiving those drugs, the higher the chances to go through a withdrawal. And also a prolonged waking up period. Now, before I carry on, you might also be interested in some further reading. We've got 2 ebooks around the 5 mistakes you are unconsciously making if your critically ill loved one is in an induced coma and is not waking up. And the other ebook we have is the 10 answers to the 10 most frequently asked questions when your loved one isn't waking up after an induced coma. I put the links to those ebooks below this video. And again, coming out of the induced coma and off the ventilator after more than 72 hours of ventilation and an induced coma might be a little bit more difficult because, as a rule of thumb, the longer ventilation and the induced coma is required, the higher the risk that complications or delays occur, of course. So, once again, if your critically ill loved one is stable, can open their eyes, can follow commands, is waking up and has shown strength to breathe by themselves, there should be no reason that they can't be taken off the ventilator after 3 to 7 days, generally speaking, even if your loved one is still a little bit confused, agitated, and/or aggressive. Number 3. Induced coma and ventilation for more than 7 days. If your critically ill loved one has been in intensive care for more than 1 week now and has been in an induced coma and has been ventilated for more than 1 week by now, you're probably wondering, and you are more importantly worried, when your loved one will finally come out of the induced coma and can come off the ventilator and the breathing tube. Just like in the example in number 2, the longer your critically ill loved one has been in an induced coma, the higher the risk of your loved one going through a delay in waking up, or they might be going through a phase of confusion, agitation, and sometimes even aggression due to the side effects of the sedatives and opiates and due to possible or likely withdrawal from the sedatives and opiates. As a general rule of thumb, you need to be patient. Even if your critically ill loved one has finally come out of the induced coma, you might experience that your critically ill loved one seems confused, agitated, drowsy, or sometimes aggressive. And you would be shocked and maybe even embarrassed by what you see. But it's okay. Know that it's nothing unusual and it happens all the time in intensive care. Also know that many patients can leave intensive care whilst they are still confused as long as they are stable and off the ventilator. What you also need to know is that most critically ill patients don't remember their time in intensive care, so don't worry too much about the confusion and agitation if that's what your critically ill loved one experiences. Now, if after 1 week of ventilation and an induced coma, the intensive care team still doesn't feel confident to take out the breathing tube, they may suggest to insert a tracheostomy. Before they actually suggest a tracheostomy, they should try and get your loved one out of the induced coma first. And if your loved one is waking up and is cooperative and is able to breathe, the intensive care team should remove the breathing tube and give your critically ill loved one a fair go, so to speak, first, to find out whether your loved one can breathe without the breathing tube and without the ventilator. If that fails, the intensive care team would have a fair point to suggest a tracheostomy, but once again, that shouldn't be brought up before or after at least 7 to 10 days of ventilation. And again, it shouldn't be done until the intensive care team is certain that there is no other alternative. Other important issues to consider when your loved one isn't waking up after an induced coma. If, for example, liver function and kidney function is impaired, it might take longer for sedation and opiates to be metabolized and excreted. Hence, waking up might take longer because the liver and the kidneys are not working at full capacity. Sometimes, even when sedatives such as propofol or diprivan or midazolam or Versus have been ceased, your loved one might still be on opiates. Opiates again are painkillers such as morphine or fentanyl for pain relief, and the main side effect of opiates is respiratory depression. Hence, waking up once again can be delayed until fentanyl or morphine are seized and out of the body system. Also, another sedative that has been used in ICU in recent years is Precedex, also known as dexmedetomidine. Precedex or dexmedetomidine is a substitute for commonly used sedation and opiates. Precedex or dexmedetomidine, among others, is an anxiety-reducing sedative and pain medication. Dexmedetomidine is notable for its ability to provide sedation without risk of respiratory depression, unlike other commonly used sedatives such as propofol, fentanyl, midazolam, etc., and can provide cooperative or semi-arousable sedation. Similar to clonidine, it is an agonist of alpha-adrenergic adrenergic receptors in certain parts of the brain. Clonidine is sometimes also being used for light sedation, some pain management, and also to manage withdrawal from mainly opiates like morphine or fentanyl. A further delay in quote-unquote waking up after an induced coma can also occur when during the induced coma muscle relaxants, also known as paralyzing agents such as rocuronium, becuronium, cisatracurium, etc., are given to manage extreme agitation, high intracranial pressures, or to facilitate mechanical ventilation in patients with acute lung injury or acute respiratory distress syndrome, ARDS, and to prevent and treat shivering in patients undergoing therapeutic hypothermia. So, and if you still feel like you and your family have little or no peace of mind, no power, no control, no influence, and if you need a quick and in-depth education that gives you peace of mind, control, power, and influence, I'd really suggest that you keep on watching, because the question is, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find international phone numbers on the top of the website. Also, have a look at our ebook section And you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll see you again next week in another update.